RR is irregular, but there is no visible PA. The PA is undulating. So it's a patient with atrial fibrillation, with bradycardia, with lower fixed heart rate. And if the patient is on digoxin, I will suspect digoxin toxicity. So to conclude, be ready to confront arrhythmias. Forget the ECG, see the patient first and check for vitals. If bradycardia with hemodynamic compromise, DC shock. If bradycardia with hemodynamic compromise, pacing. Treat all the white QRS tachycardia in presence of coronary disease as ventricular tachycardia, and if you cannot diagnose and white QRS complex tachycardia, treat this as ventricular tachycardia. Thank you. Thank you very much.
Thank you for covering this such a vast topic in such a comprehensive manner. I think we already overshoot the timing. Would like to conclude here. I think no more questions. I think we should conclude the session here. Thank you.
Thank you, Dr. Pawan, for making such a difficult topic to a such simpler one. I have known Dr. Pawan for a long time, and he is such a great academic taste with ethical nature and such a soft spoken that he can only be. So there are three stalwarts of arrhythmias, I can say, or EPS. Dr. Sunil Sofar, Dr. Pawan over here. If anybody wants to ask some question, we will invite one or two mostly from the audience. If no, it would be better in our time interest. So thanks a lot. Now I will invite Dr. Upender Singh, sir, to please felicitate has honored us by coming here. Sir has taken the please sir. Dr. Vaishnav. Thank you, sir. Sir, please. Dr. is a very senior physician in East Delhi, and he is practicing senior physician in Max Patpadan, and sir was one of the cardiology faces in East Delhi in his time, and now we are honored by his presence. For around 2-3 months back only, and whenever I have said, I thought that he may not be able to come, I am a small soldier only, but he has graced every occasion whenever I have invited him. Now thanks a lot, sir. We will also felicitate sir Aryo and sir, because scarcity of time, we are just bouquet. Sir, something. Dr. Vaishnav sir, as he left the stage, sir, I would like that you have 2 words only, because sir is also a new.
We all know Pawan is such a dynamic person, such a lovable person. मेरे कॉलेज का है, वो होनहार विद्वान के होते चिकने पार, तब से इतना एक्टिव है, and he has organized such a good conference, and being a Sunday, such a good attendance, and God bless him. And thank you very much.
Now we move on to our next session, that is BLS guidelines. What is new? Basic life support. This is basically for every doctor for the initial basic life support, and the speaker is Dr. Narendra Jha. Dr. Narendra Jha, please.
I get an opportunity to talk on a BLS after arrhythmia. Okay. So if you can't manage arrhythmia, then you have to go for somewhere life support. Because, it's a very precarious situation for me, because as a pediatrician, I have to talk about the BLS in the stalwarts of the cardiologist. Okay. So whenever there is any misinterpretations or anything is missing, so please, sir. So because there is a time constraint, so I am limiting my talks to just changes in the BLS sequences. And there is changes from 2005 guidelines to 2010 guidelines, and these are the revised guidelines. And now in 2015 there is few updates. So I'm limiting my talks to just 3 videos, which gives you all the guidelines which are changed.
I'm really bored of my work.
Same here, man. Do you want to do something?
I was actually thinking of going for vacation.
Vacation sounds good. Where do you want to go?
Let's go to Kerala.
Kerala is nice, but I've already been there.
Then how about Goa?
Goa, okay.
Naren, are you okay? Naren, what happened to you, Naren? Naren, help! Help! Naren, Naren, help!
Coming through. See you safe. We'll take care of him, sir. Please stand back.
Sir, are you okay? He's not responding. He's not breathing. There is no pulse. Grab the AED. 1, 2, 3, 4, 5.
Push hard and push fast. At least 5 centimeters or 2 inches. Remember, his chest needs to recoil completely before each compression.
19, 20, 21.
Minimize interruptions between compressions.
26, 27, 28, 29, 30.
Do not touch
AED is
patient.
analyzing the rhythm. Let's switch our
Please
position.
wait. Preparing shock. Move away from the
AED
patient.
has advised shock. Everybody stay clear. Delivering shock.
Shock delivered.
Shock delivered. Begin CPR. 1, 2, 3, 4, 5. 24, 25, 26, 27, 28, 29, 30.
Do not touch patient. Analyzing heart
AED is
rhythm.
analyzing the
Please
rhythm.
wait.
Let's switch again.
Preparing shock. Move away from the patient.
Shock advised. Everybody stay clear. Delivering shock.
Shock delivered.
Shock delivered. Resume CPR.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 26, 27, 28, 29, 30.
Do not touch
AED is
patient.
analyzing the
Analyzing
rhythm.
heart rhythm.
Let's switch.
Please wait. Stop CPR.
He is breathing spontaneously. There is pulse.
Let's shift him to the ambulance.
As you have seen just now, a normal healthy person, as shown in the previous clip, can also develop an acute cardiac event requiring a CPR. And these are the situations where your skills and discipline can save somebody's life.
In this 2015 guidelines, there is a booklet which is not published yet. So there is some executive summary in AHA journals. They say that activate emergency response system even without leaving the victims. Initially, they say that leave the victim and activate the emergency response system. Now they also started. You can give by even mobile phones. Earlier they used to give certain things. Now you can activate the emergency response system via social media or WhatsApp or anything you can use. And if there is a trained receiver, then they can synchronize, perform breathing, check for the breathing and the pulse check. And one thing I make sure that the BLS is not done by doctors only. Now the lay risk persons or even a lay persons who can do. So this is called bystander CPRs, where you have, if you are seeing a individual who is not responsive, who is not breathing properly, no need to go for check the pulse. You start chest compressions, because this will increase the chances of survival of the victims. So there is a minor changes in 2015 guidelines. With chest compressions per day, they are given as 100 to 120 per minute. Initially, from 2005 to 2010 guidelines, it was at least 100 per minute. But there is upper limit they have set, that is 120 per minute. You can't go more than 120 per minute. Secondly is chest compression depth. So it was at least 5 centimeter, that's 2 inches in the adults, but you cannot go more than 2.4 inches or 6 centimeter. And allow full chest recoils. So earlier they said that you have to make contact in the sternum to give the chest compression. Now they said during the recoils you have to withdraw yourself from the victim so that you give full chest recoil. So these are the significant changes. Other things also change, but it's basically for trained or health professionals only. So because now they have added, if the person is non-opioid poisoning, then you can give naloxone injections also. But these things cannot be possible as a bystander CPR or lay persons. But for lay persons, high quality CPR will be the heart of the BLS. That is push hard and push fast. The rate should be something about 100 to 120 per minute. Depth should be adequate, minimum 5 centimeters in adults and in pediatrics, and 4 centimeters in infants. And allow for chest recoil. There is no need to go give ventilations if you are not comfortable or you find that drunken patients or any infection chances. But minimum thing is chest compression, because this will increase the chances of survivals. I think many of the cardiologists will agree with the return of spontaneous circulation.
Thank you, Dr. Jha. I think basic life support system, as a term denotes, you can only learn through the videography, which is very rightly done, and I think that is the best thing. But not only for the doctors, lot many people in our country die, mostly roadside victims, people with mild infarction, who do not know this. So the need of the hour is not only doctors, policemen, paramedics, students, In other countries, Britain, America, the college students, the undergraduate students, and even the middle level students are taught basic life support system. So, the public has to be aware, because by the time a paramedic comes or a doctor comes, time is lost. So time is life, and therefore, the basic life support system is an ingredient, essential aspect for not only us, but we also must teach the school children and other subjects of the society so that we can benefit at last.
I would like to add a few things. Being a doctor, when you are resuscitating a patient in the hospital, once you are through with the basic life support, you have put the patient on the ventilator, and you see that the patient is unresponsive, though his heart is on, the rhythm is there, his BP is there, but you see that his pupils are dilated. That is the right time when you should start thinking about organ donation. That is the time when the ICU staff should go and counsel the patient's relatives for organ donation. That is another addition. Then, as Dr. Jha said, there is an addition of giving naloxone in case you are suspecting opioid poisoning. That is immediate thing. And the first thing they say is the effective chest compression, which he rightly emphasized that is the most important. Without trying to ventilate the patient, you have to give effective chest compression. It is said that even if you do not give ventilation for 10 minutes, there is adequate oxygen in the blood. But if you can maintain the circulation to the brain and to the heart, that is how you can revive a patient. I think that's, these are the latest 2000.
Any question or queries? Dr. Jha will be too pleased to answer them. Yeah. Yes, sir.
Responsiveness is not difficult even for a non-medical person, but checking pulse may not be always possibly right for a non-medical. who should be authorized to start the CPR in a roadside?
Sir, any bystander victims, if person is not responding to sound, stimulus, and there is no evidence of breathing, movements of the hand, without checking pulse, you can start chest compression.
Thanks a lot. First to Dr. Naren Jha, who has presented in a short time and such a well discussion on this topic, which is basic life support. The first for the survival of all. So Dr. Chaturvedi has summarized that everybody should know the basic life support, because for sudden death, we all know the basic life support can prevent it. So I am obliged. Now I request Dr. Shirish Jain sir to felicitate Dr. Shirish Jain sir. Dr. Shirish Jain sir is